I'd like to call to order the Public Safety regularly scheduled meeting. Monday, June 20th at 5:30 p.m. And we have one counselor, one member of the Public Safety Committee zooming in, Counselor Pankaj Prakash, and he's here. Our Emergency Management Director is out sick. And I believe we have Kim Rickey sitting in for?
I'm sitting in for Brian Goodrich.
Brian Goodrich. I think we're good to go. And with that, do I have a motion to approve the minutes?
So moved.
Second, all in favor?
Aye.
Aye, they pass. Now we're open to public comment. I see nobody in queue on the internet, and I see nobody in the audience for public comment, so there are no public comments at this time. Departmental updates, we'll start out with fire.
Thank you, Mr. Chairman. I'll just hit a little bit of our data and then a couple other comments. Incidents responded to were 58, brings us up to 251. Slightly off from last year, although we have seen an uptick in the past week or two. Training hours, 441, brings us up to 1813. One injury recorded, and total active membership, and this is what one of the things I want to talk about, is 68 with 62 active. We have one on FMLA, one on military leave, one on an educational leave, etc. I have the May 2021 report with me. We're down membership from last year, 2 active members. We were at 64 this time last year. With 62 active, however, we had a total of 75 at this point last year. Our total is 68 now. I'm a little bit concerned about this. Reason being, as the economy slides, historically membership slides also. It just becomes more expensive, and people become busier at this time. And volunteerism tends to take a back seat to social and economical issues. We saw this in 2007 and 2008, and we're beginning to see it a little bit now. We've taken a proactive measure of increasing the pay-per-call amount. As you know, we're seeing gas prices that we've never seen before. And we're going to look at it again at the midpoint of the fiscal year. We will continue to monitor this and report as needed on that. Few other things. Marine One was serviced, inventoried, and put in service for the season about the 3rd week of May. It's docked next to the police department boat at the public safety docks. We outfitted the apparatus with new AEDs for all the frontline apparatus and couple of the fly cars. We ended up replacing all our DeWalt battery-operated tools, which are sawzalls, drills, etc., that are carried on the apparatus. They were just failing left and right. The batteries failing and the tools failing. We were able to get new Milwaukee tools and work well within the budget on it. So as they're received, they're heading in. They're being placed on the apparatus. We have 3 new members who are in various stages of the pipeline between background checks and physicals. 2 will be online firefighters and 1's heading to the fire police. We have listed our public information. Under training, it's very important to mention that we have 2 newly certified firefighter 1s. We have a newly certified firefighter level 2. a newly certified fire officer, and we had one member complete pump operator certification. A lot of work went into those. Well, this time a month ago, COVID was on the front seat. We still have our precautions in place. However, we have nobody out and have had nobody out for about 3-4 weeks with COVID or COVID exposures. And our safety committee met a couple of times, and one of the big topics we're working on is an apparatus training program to enhance our education and recertification on all the apparatus. Per the national standards, as well as the insurance standards, we need to recertify on the apparatus every year. So we are working on that, as well as trying to enhance our I-91 blocking procedures. Lastly, just like to hit a little details about a rescue that all 3 services were involved earlier this afternoon with. An elderly lady was walking into her house. She was being assisted by a caretaker with a gate belt. She went to rest on her wrought iron railing. Her knees gave out. Both knees pushed through the railing, and the way she landed, she was unable to get out. Between EMS, PD, they were there, did their best, called us. We ended up using a set of jaws just to move the wrought iron railing. This was the old school, solid, welded in place railing, so it wasn't moving without heavy help, and just thank you to the other services. She's doing well, non-life-threatening injuries up at the hospital of Central Connecticut. And that's all I got.
Sure. Any questions, Councilor O'Sullivan?
Yeah, so Chief, just in the in the overall decline in membership from 75 a year ago to 68 this year, I think those are figures you gave. Yeah. Is there any common theme there? Leading to that net -7, or is it just kind of 7 different individual circumstances and just a bad coincidence?
Out of those members, 3 of them retired. 2 had at least 30 years service, so they more than did their time. And what we see is life gets in the way. I can think of one member who 2 kids in the last 3.5 years. The priorities definitely switch on that one. The needle moves there. You've got to take care of your family. I mean, we've all had them that young, and we know how much work it is. And he thinks it's busy now. Just wait till t-ball, softball, basketball, soccer ball, and all that other fun stuff. That's what we're finding is just life's getting in the way. And one member went to school, didn't come back, went out of state to college, somebody hired him up. It's stuff like that. So we do see a lot of turnover, but once we get them here and we have our programs in place, thanks to everybody's help, with the tax abatement and the pension plan, we try to look for that, the roots to go down 20 years.
Right.
So I hope I answered it the best I could.
So the net minus we have here, is it because there was unusually high number of minuses, or is it not enough pluses? In other words, normal churn, but you're just not getting the replacements? Is that kind of what it is?
I'm worried about the pluses, yes.
Okay, yep.
I'm worried about them coming
So
in.
normal number of people leaving, but just not replenishing as much as we'd like to.
That's exactly it. Thank you.
Councilor Prakash? Any questions?
No question.
No
questions at the time.
Councilor Prakash.
Thank you.
So again, the top line number was 73, you said a year ago?
A year ago, Ed, and I can give you this if you'd like, I've got the cover sheet, was total 75 with 64 active.
70.
There were some medicals and FMLAs, and a year ago we were a lot deeper into COVID than we were now, so that That might have been something part of it.
Yeah, at the 75 level is a good operating level because you always have a cushion for the coming and goings. Whereas now you're operating at 68 and you lose a couple and now, you know what I mean? And if you don't get the pluses right away, it's a little bit tighter.
Right, and I did look through the report, and as part of our report that we send out, we talk about, and I'm trying to find that, there it is. We talk about, we send you a report about manpower analysis by incident, or personnel analysis by incident. Out of those 58 incidents, the individual's members left their houses 732 times, and it put an average just over 12 and a half members per call, on a call. However, that number can be a little misleading because as you look at service calls, a lockout of a house, a mutual aid call, a public service call, a drone call, those are only one crew call, so we're only sending 6 people there, so that lowers this number. As I look at some of the bigger calls here, the average attendant, on some of them, 24, 22, 33, 25, so we are getting the numbers out where it counts.
So that's better than 6 months ago or 4 months ago when you were a little concerned about the turnout wasn't quite as high, and we're saying, hey, guys are working full-time now.
Right, when I reported that 4 months ago, I was very concerned with the daytime
The daytime
response.
calls, yeah.
This information I read to you is based on a 24-hour clock, so it's not broken down by days.
Okay.
I can tell you our busiest daytime hours, though, are between 7 and 3. And without having the exact numbers in front of me, I believe about 40% of the calls are received during that period.
And is it 4 that are in the pipeline? Are those already counted in active? So you have 2 members completing Fire 1, 1 member completing Fire 2 instructor, 1 member completing fire officer, and 1 member completing pump operator. So they're actually in the count.
Those are in the active count. The 3 members in the various stages of the pipeline are not.
So then the active account is 65.
So, yeah, the active count will go up to 65 very shortly.
Okay. All right, thank you.
Okay, thank you.
I'll take that old page.
Yeah, I'll bring that over to you.
Cool.
Okay.
Very good, thank you. All right. Ambulance.
Rocky Hill Ambulance had a total of 440 calls for the month of May, which brings the 2022 total to 1,815. Total of 11 canceled calls, 8 of which were no patient contacts. 1 call was canceled prior to arrival. 4 were lift assists, 4 lift assists for the month's 11 refusals of transport. There was 1 opioid-related transport and 3 cardiac arrests during the month of May. In May, we also participated in 2 community standbys, 1 at the fire training grounds and 1 at the Griswold Middle School for the road race. We also participated in the Memorial Day Parade, and I want to just give kudos to the parade planners. We had 46 hours of training. 1 was Stop the Bleed, which is a program that the ambulance put on 9 classes over the month of May. And then 1 is what's called triage. And it sounds like I have a speech impediment, but it's not. It is a form of triage reporting that we in EMS do, and it's done on an app on your phone. We have been, through the years, we've used the radios so frequently, it's hard for us to get used to that. Not all services use that form of communicating with hospitals. We're still used to picking up the radio and saying the words versus pressing a few buttons for the more serious of the calls. but we continue to work on that. For the month of May, we have 11 new members, 6 of which are actually actively riding now as probationary members. So they're recently certified EMTs. We have 2 that are actually EMTs that had let their cert lapse and are back in the fray again. So they're probably going to be cleared, if not this month, next month. Active riding members 34, associate members, non-riding 8, probationary members in some form of training, either going through onboard training now or haven't even got on the ambulance yet, 15 total. 3 on medical leave, 4 on school leave, and 1 on military leave. I also want to talk about trends. Mike Garrihy did talk about the trends in volunteerism. Obviously, volunteerism is down. We're seeing in the ambulance a lot of school students, college students going into the medical professions. They need patient contacts, so they become EMTs and they do their ride time. And some may stick around. We have, I think, 6 that are from Rocky Hill now. We got 2 from the Tri-Town class in the spring. So some of them may stick around, some may not. But oftentimes medical students, PA students, they get their ride time and then they move on. They may come back on college breaks, which we welcome. They may come back, at Christmas breaks, and they may come back after they graduate to get additional patient contacts. But they're local people that do help us out when needed. We do see a trend in lift assists and falls. Obviously, the population in Rocky Hill is aging, as it is everywhere, so we are seeing that trend. We're also seeing a lot of patients with needs that go beyond EMS. People that need aids or healthcare aids that don't have them. People that have mental health needs that don't get them. Or need adaptive equipment to make life easier for them. So we're seeing a lot more of that. We're seeing a lot more of the hoarding and blight issues. I see it on both sides of my job, my volunteer life and my paid life. So we had a call recently where we had fire marshal on scene, we had police on scene, and we contacted Human Services Director also on scene. And I want to shout out once again to one of the police officers that was extremely helpful with that particular call, and I think I mentioned that to you, Chief Custer. And Frank Kelly came out on that call as well, and it was a big help to us. So, but we're seeing more and more of these issues. So I think more important for me personally than just the numbers of the calls we do is the trends of what we see, whether it be the opioid use, whether it be the mental health, services provided, or the need for people in the community that need help with assistance through Human Services. So I think that's almost more important than some of the numbers sometimes. We have, for May, Rocky Hill did 112 calls, Aetna, the paramedic service 328 for a combined total of 440. Keep in mind that Rocky Hill Volunteer Ambulance operates from 6 p.m. to 6 a.m., Monday through Thursday. Friday night, we start operating at 6 p.m. and go through Monday morning at 6 a.m. Aetna provides the paramedic services 24/7, but they do operate in town from 6 a.m. to 6 p.m.
Aetna's 24/7, 365?
Correct. But they provide the paramedic services.
Paramedics, right.
Yes. And then during the day, they provide both ALS services and BLS services.
Okay. Questions? Counselor O'Sullivan?
Yes, thanks. Kim, the number of service calls in the month of May is that's a big number. I mean, that's a big jump from previous months this year, particularly the daytime Aetna hours. Anything we should read into that? Is it just statistical noise, or was there something going on here? That's almost 100 more calls than in the month of April.
I don't know that there's anything specific. Keep in mind, we are and I have to go back to this, we do have several nursing homes in town and skilled care facilities in town. Also, as I said, our population's aging, and a lot of the calls we do get are falls for those facilities. But I don't see anything that, in particular, that stands out.
Okay. And you also talked about the other types of service needs that you took note of with a lot of the people who require your service, whether it's referrals for mental health or whatever else. Can you talk just a little bit about what type of lines of communication we have? If your people are on the scene, take someone in for a situation that has a mental health element to it, something like that. Is there a system in place for your people to make a report and refer these type of people to the resources they need?
Well, I have talked to Melissa Hicks also, and on scene, oftentimes, if it's not EMS contacting human services on scene, it will be one of the officers. We have a lot of police officers in town that are very well attuned to this, and I'm, once again, kudos to police department. They do contact Melissa Hicks on scene if needed. But I did sit down with her and ask if there's something else that we can be doing in EMS, because we see it a lot, because we actually go inside the unit and we do see it a lot. But there are state agencies that can help out also. That's not what we're there for, but if we had a resource sheet or something we could bring, and give to them,
Thank you.
Councilor Prakash.
Yeah, just a quick question. I think if I heard you correctly, you said 11 new members coming in. So that's a healthy number, but you do seem to be concerned about the general volunteerism going down, though, right? Is there a lead time to get to those new members? Just like fire, probably training time?
Oh, as far as, I can't quite hear. Was it?
15 new
Yeah, but
probationary members, and are they, what was that, Punkage? Your
Lead time.
lead time?
lead time for bringing them on?
Okay.
Yeah.
Well, depending on the state, I mean, we have, as I said, we have 2 that were EMTs in the past. One of them had let their certification lapse. One of them took a extended break for family reasons. But those people will be up and running shortly. They have to get used to our system and where things are on the ambulance to make sure. So maybe a month or 2 and they'll get up and running. Others are brand new certified EMTs, so that takes them a longer time. We do have something in our bylaws that talks about a 6-month probationary period, after which time the executive board can extend that by an additional 6 months. So typically it doesn't take that long. It depends on the individual, and we work with them.
Okay. Thank you.
Okay. You're welcome.
My question, on the 15 in the probationary pipeline, are they new to the organization? Just kids coming out of,
some of
coming up
them-
the ranks and
yeah,
or
some
new
of-
people moving to town, or?
Some of them are new, as I said, and some of them being new certified EMTs. Probably half of them are from Rocky Hill. Some come as far as Southington, Manchester, Berlin. So we have people that are in other classes that come to Rocky Hill also. Some are coming back. Some have left and are now to whether go to college or whatever, and are coming back. So various states.
And a quick question, were you at the knee stuck in wrought iron fence episode earlier today?
No, I was at my zoning. I had my zoning hat on earlier today.
Not you, but the ambulance.
Aetna was there. Yes.
Aetna was there.
Aetna was
Okay.
there. Yes.
Okay. Police.
All right, for the month of May.
Thank you.
There were 3,884 calls for service to the dispatch center. We had 25 criminal arrests for the month of May. Investigated 47 motor vehicle accidents, 4 of which were with injuries. We had 8 DUI arrests for the month, issued 105 infractions, and an additional 375 warnings, for a total of 480 motor vehicle contacts. There were 64 animal control related complaints for the month, and our training hours were 546 for the month. Tracking the motor vehicle thefts, we had 2 for the month of May. So as the trend continues, that activity has calmed down quite a bit. And in terms of thefts from motor vehicles, we had 6 for the month. And in the graph that was provided for you, those also you can see have been trending downward. So we're going in the right direction with those 2 categories. In terms of staffing, we're fully staffed. No people out, no people on injury leave, no COVID-related problems. Full staffing, sworn and civilian. For community service events for the month, on May 4th, officers participated in a Cops and Kids program with the Rocky Hill Youth Services Department. May 7th, officers participated in the Cadet Academy at the Connecticut Police Academy in Meriden. This is a statewide day-long event where the different cadet chapters from the departments throughout the state come and they compete against one another in a Stations Day type of atmosphere on random law enforcement type events. These are all young kids who have an interest in potentially careers in law enforcement. So we were represented there on May 7th. May 17th, officers were invited to the Creek School here in town on Brook Street. They have formed a newly formed, I should say, Student Safety Patrol. So our officers gave them some guidance and instruction on, general safety, and there were questions about police training and what police officers do. May 19th, Rocky Hill Police teamed up with the Weathersfield Police Department at, I can't think of the restaurant, Town Line Road.
Wooden Tap.
Wooden Tap.
Wooden Tap.
Yeah, they participated in their first Tip-A-Cop event, which is to benefit this Connecticut Special Olympics. So the 2 departments held a friendly competition. I'm happy to say that the Rocky Hill Police outraised the Weathersfield Police. all proceeds going to Special Olympics. May 23rd, officers participated in the West Hill Fun Run, and this event culminates the school year as a fundraiser for the kids where they collect money and pledge to run a certain amount of laps, and our officers ran along with them for encouragement. May 25th, officers participated in a merit badge event with the Rocky Hill Cub Scouts. The Scouts were receiving merit badges in fingerprinting, so we had officers there to represent the Rocky Hill Police Department. We took part in the ceremony, and the kids were able to ask questions about law enforcement and careers in policing as well. We still continue to participate on the Greater Hartford Task Force. Basically, our detectives, the task force is now working 1 day a week. It's trimmed down because the problem has kind of faded a little bit, but the funding that was available last winter obviously has dried up. So they're going out 1 night a week. It still continues to pay dividends for us. Since the unit was formed, they've recovered 189 stolen vehicles in the Capital Region area. They've made 76 arrests for stolen vehicles, recovered 17 firearms, served 74 outstanding warrants on individuals they've come into contact with, and another 32 miscellaneous arrests. Like I said, it continues to pay dividends for us to participate and network with this. Intelligence is one area of benefit, but we recently had an individual commit a robbery and burglary here in town, and we had some information on the vehicle. Our detectives, working with the auto theft unit, collaborated together, and within short order they were able to identify a suspect who indeed turned out to be the individual involved. An arrest was made. So again, because of the contacts that we have with this regional unit. Other than that, the only other thing I wanted to mention was yesterday afternoon, our drone team had their first official police call out. The drone team, as you remember, is that collaborative between the fire and police personnel. Federal agents were here in town. They had a warrant to serve on an individual in one of the local hotels who fled as soon as he saw them. So they reached out to us to help trying to set up a perimeter and search the wooded area. So the drone team was actually utilized. Did a good job. Unfortunately, the guy got away, but you know, it was the first time we used it, and you know, procedurally everything went well. So I'm pleased with that, at least. Other than that, that's all I have to report this time.
Thank you. Councilor O'Sullivan.
Yes, thanks, Chief. So showing the trends on all the motor vehicle-related matters seem to be very encouraging. Thefts of cars, thefts from cars, and the catalytic converters as well. And that's very positive. And just anecdotally, we're just not hearing as much buzz about it. Can you tell us, are the other towns in the task force experiencing the same kind of trend?
Yes, yeah, we're seeing it pretty much throughout the capital region. I don't want to get too confident, though, because you can get one spike, you know, one weekend, and you know, you can get 5 or 6, but yeah, it continues to stay much quieter than it was a year ago. So hopefully it continues.
Great, thank you. I have nothing else.
Councilor Prakash.
Yeah, so Chief, obviously, in the since we have had our last meeting, there have been incidents of you know, school shooting, unfortunately, you know, in Texas, and a lot of parents, like myself, are very concerned about these incidents, and we see these incidents through the prism of like how well we are prepared here in Rocky Hill, and you know, from a police preparedness standpoint and from a system preparedness standpoint. I know you know, you can comment and you can you know, walk us through the police preparedness part of it. Unfortunately, today we don't have our you know, emergency management director here. I think he's sick, but you know, if you can like address those two things. I know you work very closely with Mr. Pendle, so Chief, you can walk us through and through not necessarily the procedures you have in place, but at least a high level preparedness assessment of school safety.
Sure. So, you know, we work closely with the school system and the staff and faculty there. So we, just to, you know, quick recap, we have 2 school resource officers. You know, the challenge for us is we have 5 schools. So, you know, we do the best we can in terms of covering the schools with the 2 officers we have. One officer is predominantly at the high school the majority of the time, and that's by design. And then that leaves the other 4 schools to be covered by that other SRO that we have. So he spends his time, he breaks up his time amongst those 4 schools during his day. I will say that all the arrivals, student arrivals, every day at all 5 schools are covered. And when they depart for the day, those are all covered. We've worked with the Board of Ed, I should say the superintendent, to stagger those times so we can move our people around. So we do have coverage during those 2 critical periods each day. We've worked with the school system and trained them in the ALICE, which we've talked about here at Public Safety, the ALICE response for active shooters, active assailants. ALICE, again, stands for acronym for Alert, Lockdown, Inform, Counter, and Evacuate. So all of the school faculty and staff have been trained in that. They have now been trained as trainers to continue to train their people in that, as well as the police officers. So we've given them that piece, in addition to some of the other materials that are out there that come down from DOJ, FBI, so forth, so on. They continue to have regular drills, Punkish. Our SROs are involved, coordinated with those drills. Some of those safety drills may be lockdown oriented. Others might be evacuation oriented. That's usually the call of the school principal. But we do participate in those regularly throughout the school year. In addition to that, normally what I do during the summer is the SROs come back into the patrol force to kind of augment the patrol division during those 3 months. We're not going to do that this year. We noticed last year there's a lot of events going on in town, youth-related, and at the schools all summer. So we're going to continue to use those SROs to be at the school, high school in particular, and Elmridge Park for the Park and Rec programming with the kids. We're going to continue to have that coverage, and we haven't done that before. And the other thing, the other adjustment we also made is now pretty much exclusively all the youth-related complaints, issues that we're having in town are being handled pretty much just by the SROs. We're finding a correlation that kids having trouble at school are the kids that are having trouble, obviously, at home. So there's familiarity there that is very beneficial. So they're basically now handling the bulk of those calls happening in town rather than send random police officers, depending on the situation, of course. So, those are the adjustments that we have made. We're confident that we're fairly well prepared, but I say that with caution. Uvalde, the school itself, was doing many of those things that I've mentioned and plus some, but yet a door was left unlocked, and that's all it took. In terms of the police response, I'm completely puzzled by that. There's a lot of conflicting information out there in terms of why they did what they did. I know it's being investigated by the Department of Justice. We'll find out what mistakes were made. But I will just tell you their response was completely contrary to what we train and what the national trend is. So we'll see how that plays out.
Sure. So sounds like, Chief, thank you so much for that update and that brief. It sounds like you are very confident in our preparedness. One thing I would like to ask you about is the general system communication. Without going into any details, which you probably don't want to divulge in, from a protocol perspective, from an emergency management perspective, is the chain of command in place to communicate quickly any incidents when they're triggered, right? Or they take place, they get started, right? From a communication standpoint, are we in a good place? Do we have that system in place to communicate to, let's say, from the SRO to the Board of Ed to the town manager to the mayor and the general communication chain, I would say.
Yes, we do. And in the schools in particular, we have the ability for direct communication to every school. They have the ability to have direct communication with us on the radio frequency, real time, as it's happening. And those are tested weekly. Those systems are tested weekly. Same would apply with, our contacts with not necessarily the Board of Ed, but with the superintendent's office, SROs, et cetera. So yes, all those mechanisms are in place.
Excellent. Thank you so much, Chief. I think a lot of people, right now here or at home, like whenever they watch these recordings, can take some, kind of confidence in what you have told us here. And so thank you for that. And I know, like, RHPD is on top of it, and we have the emergency management director in place at this point. So I think even that part of the chain of command probably comes in handy. And hopefully, we never have to like actually use these things ever. But I think just hearing from you is comforting and, just reassuring. So thank you for that.
You're welcome.
Councilor O'Sullivan, did you want to? No? Okay. Chief, on the, so 5 schools, 2 SROs, I mean, our geography probably is different. The proximity of our schools and the tightness of the ground we have to cover to get to schools, different than maybe, say, the Texas situation where who could get there fast enough. There's several law enforcement organizations racing to get there, and it took 30 minutes or 20 minutes or something. But in Rocky Hill, we're kind of tight. I mean, there's response time from a patrol officer, which we have on the street, to any one school. Do you have a measure of that? If a call came out, I mean, we would probably have two patrol officers there within 5 minutes.
Yeah, I would say almost
Faster than
always,
that,
yeah, probably quicker.
All 5 schools. I mean, no
we have-
school is isolated out that far from.
Yeah, first of all, we're not a county, so that's good, right? And a small town, and you're right, the proximity of the schools are fairly close. You have different layers of response depending on the school. The first layer could be an SRO in the actual building when it hits. Second layer is your patrol officers responding. I would say 3 to 5 minute response. Third layer would be our immediate ability to contact surrounding towns, the mid-state towns, Berlin, Newington, Cromwell, and Weathersfield. And then the fourth and final layer would be the Blue Plan, which we have, which goes through the whole Hartford region, up to potentially 32 participating towns. So, we've had tabletop exercises where we've played that out, and hopefully never ever have to do it in real time, but real life.
Sure. And that's not what happens in the ALICE training. The ALICE training is a smaller group, and it's staff, and it's police training. Is fire and ambulance there?
I don't believe fire.
Right now, it's just town staff.
And it's just,
Doing it in phases.
so there's 4 for June. We've done 2 or 3 or all 4?
We've done 2, and I think there's one tomorrow and
Tomorrow.
one next Tuesday. And that's
So those are done
basically
in
for
this-
town staff, which is probably the town hall employees.
Self-survival.
Yeah.
So the school system is done. Now they're working on basically town hall staff. We can go out from there. But, the ALICE program is more of a survival response training, which gives you options and insight and information that maybe a normal layperson wouldn't have.
So they'll expand it next time around to include the library, and I think they're going to do something special for the Parks and Rec and the Senior Center, and even probably do something for the Senior Center attendees and so on. But phase 1 of this ALICE training is primarily.
Right, and it's just coming back after the pandemic where we didn't have the face-to-face training. So it's come back in 4, and it was for town staff this time around.
Yep.
So, and then we have the extensions to library and other departments, but
In the future.
what kind of training goes on at the schools for the teachers and the students? I mean, do you?
It's the same thing that our town staff is getting. It's the same program. So the first wave was instructed all by police officers, and then we started sending teachers and staff to train the trainer sessions. So now they are certified to teach, and we're at the point now where they are sustaining the ALICE program through their own in-house training.
Okay.
They don't need or rely on us.
Sure. Do we, so do we audit them, how they're doing, or?
Absolutely, yeah.
Okay.
Yep.
All right, okay, all right.
Mr. Chairman, can I just circle back just for one moment? I just wanted to go back to one question with Chief Custer really quickly. I would be remiss if I not ask you on a separate, topic of car thefts, if that's okay.
Yes.
Chief Custer, I know, from a number standpoint, the numbers are thankfully, trending in the right direction. But I do hear a couple of incidents in the last week. People have reached out to me anecdotally. Again, this is anecdotal, so I don't want to generalize everything. But there were a few incidents around the Henkel area, cars, windows being smashed and rims and tires being stolen. Again, I know you can't comment probably on specific incidents, but in general, are these the perpetrators? How are we doing on that, on those incidents in the last week, without going into specific details?
Yeah, so those are those incidents that kind of run in little waves, and it had been quiet. And this past weekend, we had, I would say, maybe a handful, half a dozen incidents where cars were either broken into or they attempted to break into them. All of them were at locations like Inwood Road, Capitol Boulevard. There was one on Cromwell Avenue. So basically, again, they're targeting those areas that have cars parked over the weekend, but there's nobody in attendance. So it would be the industrial park, or True Green is a good example. Is one that got hit, not this past weekend, but in the past, because they got a lot of vehicles on site, but there's nobody there over the weekend. So we continue, when we do see these little spates, they continue to be those types of locations. And it's mostly commercial vehicles, again, that are parked for the weekend because businesses are closed, and they make for easy targets.
Yeah, and then the recordings from those commercial areas, are they put into a database somewhere where we can help incidents in the future to link those incidents to what has happened in the past? So I know the task force probably uses that data in some way, but can you talk about that a little bit?
Yes, well, I can tell you, everyone is documented if they're reported to us, and we do track the numbers. So we can go back and we can check by location, by date, time of day, you name it. We can track all of that. But sometimes, again, Henkel has reached out to us because they've been hit a few times because they're one of those classic, victims there that have vehicles parked at their facility over a weekend, generally when there's nobody there. And they are considering maybe hiring security for the weekend. We make checks of those properties. Those checks are radioed in. They're documented. I can pull that data up as well. But as you know, you can't be everywhere all the time. And so their response may be to hire a weekend security firm. They're undecided, but we've had conversations about that.
Sure. No, thank you. We'll continue to monitor the data, I guess, in the coming weeks and months, and hopefully it stays on the right trend. So thanks a lot, Chief Custer.
Councilor O'Sullivan?
Yeah, just one question. I'm just a little puzzled about the way you just talked about, Chief, these weekend thefts from commercial vehicles. What is the draw to a parked commercial vehicle? I mean, over the weekend, nobody's leaving a purse in there or shopping or anything like that. It's just not obvious to me why that would be an attractive target.
Well, it's generally the catalytic converters.
Oh, okay.
That
All right.
they're after.
Yep.
And the bulk of those are catalytic converters.
Got it.
But,
Okay.
You do occasionally get people still leave their company laptop, on the front seat because it's not theirs and it's in their vehicle, and but the majority of them are cats.
Got it. Okay.
All
I guess
right.
some of these people have not gotten the word about the new legislation that it's harder to sell those things once you steal
We're
them.
going to find out.
I hope so.
Can only come in with a couple at a time now, too.
Yeah, how do you launder catalytic converters? I don't think you can. So thank you for those updates, and we won't have an emergency management
Just a
report
couple
unless.
points, just a couple points. I won't go over all of it, but the emergency management manager, Steve, has moved from the second floor office down to the first floor of this building where the old senior center game room used to be before. And he has his office in there now, as well as the EOC. We moved the EOC over from the police department, freeing up space for them, because it was taking quite a bit of room up over there. So it's all set up. The room was wired with communications as far as televisions and all that. So he's setting that up down there now. So he'll be down on the first floor. I guess he said as of June 10th, we were able. So he's fixing that up down there. So that will be the emergency management / EOC area going forward.
Sure,
We
that's-
talked about
that's
active
great.
shooting. I think the only major emergency was that bus fire, Mike, out on the highway
Yes.
over the last month. That it was like a tourist bus that was empty that
Yes.
somehow caught fire, of course, in Rocky Hill, which usually buses
Burn
like to
magnet
catch on
on the
fire
highway
and
for-
gas tanks like to blow up and so on. So I think that was like
We've
the
had
only-
our share.
only major one. And then the last thing, the senior center, community center held on June 8th a vaccine, second booster vaccine clinic. And it was sponsored by and administered by the health district. And there was 52 people that showed up for the booster shots that day. And out of the 4 towns of the health district, Rocky Hill had the highest number of people getting boosted that day. And that was just what I thought was some high points, just to point out, since Steve wasn't here. Talk
Do
about
do you have any plans for the children's vaccine that's now been approved?
Not yet. That sort of came out kind of quickly, and I'm not sure what the health district would want to do, and maybe it's just better for them to go to their pediatricians and so on and get it. But I think this was more focused towards the seniors and so on. So at this point, no, nothing yet, because I think it's fairly just been recently approved over the weekend.
All right. Any questions? No? Okay. I don't believe we have a Central Health District update. Is Charlie in queue, or no?
I believe we sent him an invite, Daniel. So
He's on Zoom with me.
Oh, Charlie. Can
Charlie, are you there?
you turn your video on?
Mr. Chairman, looks like he's here.
Yep, sorry, guys.
Hey,
So-
listen, we weren't ignoring you on purpose. I mean, we didn't see you there. I quite honestly didn't know you were there. Thanks for waiting.
Yeah, no problem. Let me get right to the numbers for Rocky Hill. Current cases numbers per 100,000 for Rocky Hill is 34.1 for the week from May 29th to 6/11. Rocky Hill, as of today, has 4,311 total cases during the pandemic, 150 total deaths we stand at. Numbers have been going down here recently. We're starting to finally see some relief from the summertime, hopefully. We did see a bit of numbers pick up around the Memorial Day vacation, and we're hoping that, summer gatherings are done with some caution, just making sure that folks are assuring that if somebody's sick, they stay home. Follow the simple rules, folks. Vaccinations have been in the news recently with the the crowd under 5 being authorized for vaccinations now. Is the final group that needs to be vaccinated, though we're not sure exactly how many folks are gonna do it. That group generally is probably the lowest of vaccinations, just for voluntary vaccinations. So I encourage everybody that can get vaccinated, please do so. We've actually been in all 4 of our towns here recently over the past few weeks at the beginning of the month, and actually did, I believe, let me see, I think it was 58 vaccinations in Rocky Hill, no, 52 at the community center on June 8th, where we really worked with the senior center and the town to identify folks with functional needs that would need some extra attention. So we thank all of our partners in being able to make that happen. All told, we did probably about, I think, 162 vaccinations all told over the month of June for COVID. And with that, I stand ready to answer any questions that I can.
Any questions, Councilor O'Sullivan? Councilor Prakash?
No questions at this time, Mr. Chairman. Thank you.
All right.
Ed, you could ask that question. Ask me. About the kids.
Yeah, no, about the kid. Yes, Charlie.
Yeah.
John Mayer and I were talking about the new children's vaccine that's apparently available. Any news on that for our district?
Yes, that is going to be available. We are not going to be providing that particular vaccine through the district. And the main reason for that is that we have very few nurses and our volunteers that have the experience to be able to provide vaccines to kids under 5. The rollout for this is going to be different than any of the other age groups that we've had. So really, it's not probably going to be the CVS and Walgreens and the healthcare show. It's going to be much more pediatric practices that are going to be asked to step up and vaccinate. So it just got approved. The rollouts for it really has not been, identified at this point. But we, once again, we do believe that it's going to be rolled out through the traditional pediatrician, offices. So if you're interested in this, I definitely encourage folks to contact their pediatricians, let them know that they are interested in it, so that those folks can order appropriately.
All right. And, I just, out of curiosity, how, I don't know if you can ever be totally comfortable, but how comfortable are you getting with this COVID-19? I mean, for instance, what variation are we on? How many variations are there to go? Is it following a traditional trajectory as in case of vaccines? In case of viruses, not vaccines.
Where we are right now, I think, is in a better spot than where we have been, really at any point during this pandemic. And we have the tools that are in place that really are going to allow us to turn a corner on this. So, having access to quick testing, the ability to treat those people who are found to be ill, the protocols in place to kind of quickly quarantine and isolate, and then the ability to vaccinate and prevent or, mitigate some of the hospitalizations that we see. So adverse outcomes from this, really do, start to go down, and it becomes something that we can manage. All of those things in place, are going to help us to manage this disease rather than be managed by it as we have over the past 2.5 years. Unfortunately, a lot of our actions are really what causes, more variants of this to get out of hand. So, in times like now where there's high transmission within within a lot of the state, being able to make individual choices, to do the right thing with respect to masking, staying home if you're sick, assuring that your vaccinations are up to date. A lot of these things that we do individually are going to affect where this virus goes in the future. And, we can continue in pandemic mode for some time. And I think that people, once again, there's pandemic fatigue. They're tired of having to deal with the situation. They don't want to wear the mask anymore. And what we've seen, especially over the Memorial Day weekend, is, that type of behavior just gives an opportunity for a spike in the virus. And the more spikes, the more cases that we see out there is more of an opportunity for that virus to, mutate and change, have another variant that potentially is more deadly. So, do the right thing. Take what preventive measures that you can individually, and, keep an eye on where things are within the community so that we can all support each other and really handle this for the future. I hope that answers your question.
I appreciate that, but I guess what I'm hoping to hear from
What are you
you,
looking for, Ed?
from the research community to you, to us in coming months, is that they have learned something more about the virus, right? In other words, why is it affecting some folks and not others? Is it purely the practices? I could take a straw poll on the council here and see who's gotten the virus after they were fully boosted and all that, those kinds of things, right? Is there more? What's going on? The characteristics, build out the profile a little bit more. I have to imagine a lot of research studies are coming in or about to come in.
Yeah, a lot of it, Ed, is individual practices, and the fact that we have a particular variant, the Omicron variant that's out right now, that is very contagious. It spreads very quickly, very easily. And if you're not, as protected as you can be, it'll take the opportunity to infect someone and then spread from there. So what we're seeing right now, is, I think it's a good mix of people being tired and an opportunistic virus. The good news, once again, is the fact that people who are getting the virus are not becoming, ill enough to be able to hospitalize. We're able to deal with this and manage it at home for the most part, and people, are not dying from this the way they were at the beginning of the pandemic. So we're at a point, to where I think, if we can continue down this path, they're going to learn more and more about it. What concerns me, Ed, is the fact that complacency right now is a challenge for public health as a whole, because we don't know the long-term effects potentially that having COVID-19 can have. And, I use the kids, for example. People say that kids, they get it and it's not a big deal for kids. Well, it may not be a big deal for kids now, but we don't know what the effect is going to be potentially 5 or 10 years down the road. So those are only things that we're going to learn as we continue to study this virus. So we don't have issues of cardiovascular, illness or cardiovascular issues, down the road. So, I think that the academic community is doing what they can, but research does take time.
Thank you. All right. Thank you for that report. No additional follow-up questions?
Nope.
All right, we're good on that. Any new business?
The only thing I wanted to bring up is make people aware that starting today, it's the Travelers Golf Tournament. And traffic does head up Main Street to get to the Cromwell course. And I think Brian Klett is coordinating it with the Cromwell Police so that depending on the time of day, especially when the tournament is finished and people are leaving, part of Main Street could be one way, probably heading north, and be one way maybe until you get to Brook Street, where traffic that is heading south or want to go south would be shot up Brook Street and then continue north. People would continue down Main Street into Rocky Hill and Weathersfield and so on. And I believe the police are going to be sending out a code red or something, trying to make it more comprehensive of what I just said. But they should be aware of the time of day, especially in the late afternoon when the golf tournament ends and there's that big surge of people leaving, that some of the Old Main Street, part of Old Main Street may be one way heading north. And people that are heading south will be shot up, most likely Brook Street.
Sure. Duly noted, duly noted. TPC golf tournament. All right. Other business. I don't think we have other, no?
Move to adjourn.
Second?
Second.
All in favor?
Aye.
Thank you.